This is a patient who came in with screening for cirrhosis, screening for HCC. So there was all these little hypodensities, in the posterior lobe. There was no enhancement right there. It stayed hypodense on the venous and in a delayed phase. So what would you guys have? What would you have said? So I call this LRM, LR malignant. I thought this was actually, it looked like I was worried about an infiltrative HCC. The patient came back and had a follow-up, and it's all gone. It's like totally normal. So I got faked out, and I'm just wondering what I would have done or said differently.
You think do you think they were abscesses, maybe micro abscesses?
Oh, that's a good point. I don't remember. I don't recall if the patient had evidence of infection. It was an outpatient study, and I think it was just cirrhosis, screening HCC.
Yeah. Nelly, this reminds me of that other case you showed that looked like this and turned out to be infiltrative HCC. So maybe now you're biased in that direction. I was like, didn't you show us this case before? I honestly wouldn't have called either one. So I would have, I don't know, I guess we would have been 50-50 in the opposite direction. But
what would you have said? What would you have said?
Yeah, there's these tiny non-enhancing things. They could be micro abscesses or I don't know, almost like infarcted nodules. And especially if it was new, I would say. And if they had any intervention in between.
No, there's no treatment.
Yeah. Yeah, I would say, and actually I would have probably recommended an MR, because I think if you have an infiltrative HCC, you would see a huge thing on MR, right? It would be T2 bright, you'd have a T1. Mm-hmm. The fact that there's no portal venous tumor in vein here, also is reassuring.
Yeah.
Because if all of that area is infiltrative, then usually it starts growing into one of the veins.
Right.
Sure. But this is exactly what I said last time when it was actually an infiltrative HCC. So, yeah, I think it's a good lesson.
I still can't wrap my head around these findings. Yeah. That's it for me.